Good day everyone, my name is Nur Shafiqa Anwar. I will be the representative of my topic to be discussed to you today. My research proposal, this video presentation will include the discussion of the title, the background of the study, as well as objective. Now, without further ado, let's begin. So, our research is entitled Mechanical Properties of Modified Denture-Based Material and Microfiber Interaction. A great number of research PMMA reinforced with different fillers have been undertaken in attempt to improve the material mechanical properties. A novel filler combination of polyatic, acid microsphere, and hydropathitic filler was present to improve antibacterial activities against oral microbes. One of these materials is dental resin, which is used in dexterity. Antimicrobial infection is a chemical that kills or prevents germ development and reproduction. The removal of antimicrobials from denture-based resin is crucial for preventing oral infection and disease. PMMA is sometimes known as acrylic glass or plexiglass because to its extreme transparency. PMMA material properties are interesting for several reasons. Its highly transparent glass-like substance with outstanding impact and environmental resilience make it suitable. Problem with prosthesis can cause inflammation and, in certain cases, infection. This improvement in mechanical and microbiological qualities will result in microbial interaction that may prevent future infection of neighboring tissue. The goal of this study is to find new filler combinations that will improve the fracture strength, hardness, and fracture toughness of PMMA resins. Another goal was to examine modified PMMA antimicrobial properties and microbiological interaction. So here is the narration that we can get through this proposal. First, PMMA with enhanced fracture impact and fracture toughness. Second, PMMA that has been modified inhibit the development of Staphylococcus aureus and Staphylococcus mutans. Third, PMMA has been changed its hybrid antifungal properties against Candida albicans. And four, SEM indicates cell microphagical interaction in Candida albicans, Streptococcus mutans, and Staphylococcus aureus on modified PMMA surface. Throughout the literature review, several experiments on PMMA reinforced with different fillers have been undertaken. Mechanical properties of PMMA composite were investigated in their study, and several shortcomings such as insufficient surface hardness, low strength, brittleness, polymerization shrinkage, weak fracture, decreased impact strength, and low fatigue resistance had a negative impact on PMMA resins. Surface irregularities present on PMMA could increase likelihood of microorganism colonization on their surface. When the surface are exposed to the flushing action of fluids, there will be higher chance to successfully colonization of microorganisms to the surface. Different fillers will have different influence toward the properties of the PMMA composites to be used as the denture base. In this project, the aim is to identify optimal filler loading to improve PMMA resins properties and the microbial interaction. PMMA reinforced with hybrid filler HA with addition of polyatic acid microsphere will be determined. So for this method, this is experimental laboratory investigation that will take place in the biomaterial laboratory. This study includes several methods. Diffusion test on agar. According to clinical microbiological laboratories, the antibacterial activity of Streptococcus mutans and Staphylococcus aureus will be evaluated in vitro using an agar diffusion technique. The agar diffusion test will be used to determine antibacterial and antifungal activities. Next is antifungal susceptibility test. The antifungal activity of Candida albicans will be analyzed in vitro by an agar diffusion method according to clinical microbiological laboratories. Analysis of cellular microbiology uses scanning electron microscopy to evaluate the possible mechanism of action and cellular target of the compound. Again, as mutant, as errors, and C albicans macrobiological analysis of the microorganism. This method to investigate the resulting microbiological change in the appearance of the cell. Next is statistical analysis. One-way ANOVA test and independent t-test will be performed using SPSS software. What we can conclude in our research. The material PMMA are used for the fabrication danger base and for other prosthesis material. The aim of the research study is to focus on the important improvement of the danger base for the microbial interaction and cellular microbiology that play an important role in forming a barrier against future colonizing of the microorganisms.